Good afternoon. I'm Tom Hudaka with the Utah Department of Health. Welcome to today's daily COVID-19 media briefing. We will have one speaker today. It will be Dr. Angela Dunn, the state epidemiologist for the Utah Department of Health. Dr. Dunn will provide an overview of the current situation in Utah. Dr. Dunn?
Okay, good afternoon. We now have 3,213 cases of COVID-19 diagnosed in Utah. That is an increase of 144 from yesterday, or a 5% growth rate. We've tested 68,311 Utahns for COVID-19, an increase of 4,756 from yesterday, and we're still maintaining a 5% positive rate overall. We did increase our hospitalizations by 9 yesterday, so for the entire outbreak, 268 people with COVID-19 have been hospitalized. We do have one death to report today. We have a total of 28 deaths due to COVID-19 in the state of Utah. The additional death was a male, older than 60, was a resident of Bear River Health District, and was hospitalized prior to passing away. He did have some underlying medical conditions, and Bear River put out a press release over the weekend with more information on that. This week at the Utah Department of Health, we are focusing on trying to understand more about why some populations are bearing a bigger burden of disease with COVID-19 than others. Specifically, we're going to be working with the impacted local health districts and community-based organizations representing these populations to understand and address barriers to testing, care, and isolation. For example, we're going to be looking at a community health worker model to ensure that all of our communities are getting the care and the wraparound services that they need. And I've mentioned before that health inequities are an unfortunate part of our society, and this pandemic is definitely bringing them to the forefront. And it's going to take a team to appropriately address them. And with that, I'll open it up for questions. Thank you.
Hi, Dr. Dunn. Where are you at in being able to get current hospitalization numbers?
So we have reports from our hospitals about their estimated current hospitalization numbers due to COVID-19. However, we're working with them on standardizing how they report so that's consistent across all hospitals. Right now, they're all reporting in a little bit of a variety of ways. And so before we present it publicly, we just want to make sure it's a consistent number. So hopefully by the end of this week, we will have that in a consistent format for you guys.
Dr. Dunn, given that we've seen fatalities increase and certainly the number of positive cases continue to increase, your thoughts on whether this is a good time to start looking at lifting some of these restrictions by the 1st of May, as the governor, Salt Lake County mayor, and others have contemplated doing?
Yeah, so we're looking at our trends of growth rate and cases, and we are starting to see a little bit of a flattening of the curve over the past week or so. We're evaluating that data further to make sure that, we had some lower testing done last week, and that can influence how many cases we identify. So we want to be able to account for that. So we'll definitely want to watch the next week or so to ensure that our flattening of the curve continues and that we start seeing a decrease. So those are some of the metrics we're going to be watching at the Department of Health.
Thank you, Dr. Dunn. It's Michael Orton with the Capitol News Service here. You have been on the record recently as saying that the state needs to prepare for a second wave in terms of the virus and its infected population. And my other question deals with that credible estimates indicate that 82% in some populations are undiagnosed, but carrying the virus. And I wonder if you could comment on both of these situations.
Sure. So there's, of course, a lot we don't know about this virus, given that it was just discovered in November. But if it is consistent to other coronaviruses that are more common, we could expect a decline in cases in our warmer months, and then potentially another surge once respiratory and flu virus season starts up again in the fall. And so as public health, we are definitely expecting and preparing for a potential second wave in the fall of 2020. That doesn't mean it's definitely going to happen, but it's something that we want to be prepared for if it does follow the trend of other coronaviruses. And what's particularly concerning about a potential second wave is that we don't have a lot of cases here in Utah, so we can't expect for a lot of herd immunity, and a vaccine won't be available by then. So we're going to have to continue to rely upon people isolating themselves when they are sick to prevent the spread of disease further. With regards to your second question of asymptomatic or pre-symptomatic spread, that's something that we as a public health system and as health scientists across the nation have discovered over the past several weeks is that there does seem to be evidence that there is asymptomatic or pre-symptomatic shedding of the virus up to a couple days before somebody actually starts showing symptoms due to COVID-19. And because of this, it's ever more important that we continue to practice social distancing until we see a stabilization of cases and start seeing a decrease in our number of cases daily. That social distancing is going to be a cornerstone of preventing this pre-symptomatic spreading of COVID-19.
Hi, Dr. Dunn. A lot of talk around the country about the importance of case tracing. I know you guys have been doing that here, and just how many people are needed. Can you bring us up to speed on how many people in the state are dedicated to that now? If you're getting help from any other organizations, I don't know, the National Guard, and just where Utah's at with case tracing now and moving forward?
Absolutely. So case investigation and contact tracing are an essential public health skill that we do for all infectious disease outbreaks. So whenever we identify a case of COVID-19, we immediately contact them and we identify all of their close contacts over the past several days, 2 days prior to their onset of symptoms up till present day. And then we contact their close contacts and let them know that they should remain quarantined and assess themselves for symptoms every day. Public health also monitors the close contacts on a daily basis. So because of COVID-19, some of our local health departments have needed extra support from the state in order to continue doing this contact tracing. So at the Department of Health, we trained up over 50 internal Utah Department of Health staff to help out with the case investigation and contact tracing. And we now have approximately 200 state employee volunteers from outside of the Department of Health who are doing the active monitoring for a handful of local health departments. Moving forward, we do anticipate that more health departments will likely need help with case investigations and contact tracing. So we're working specifically with some nurse and case managers within our Medicaid department, and also some nurse managers and case managers with Intermountain to be able to do case investigation and contact tracing, because that does require more of a health skill set to be able to appropriately evaluate risk of individuals. So we're really working hard here in Utah to ensure we continuously have the capacity to do contact tracing and active monitoring throughout this outbreak.
Hi, Dr. Dunn. I have a couple questions. Firstly, I wanted to follow up a little bit on the question that Ben Winslow asked you a few minutes ago with regards to, whether or not we're seeing the curve start to flatten and, whether it's the right time to talk about opening up some of these things in our economy. I think towards the end of last week, they were talking about, or some of the state leaders were talking about, accelerating that timeline to open the economy again, because there had been a few days where we saw, under 100 new cases. But now over the last few days, we've seen it jump back up over 100 again for the last, 4 or 5 days. So, does that concern you, seeing that go up over 100 again? Does that suggest that maybe we're not, in fact, seeing the curves start to flatten? And then I had a second question. I've seen some models suggest that we might see a peak in deaths this week in Utah. I know you've talked about that there's a lot of models out there and they may not all be accurate, but does that match with what you're seeing? And I guess what models do you trust as far as when you're looking at the number of deaths in Utah?
Sure. So to answer your first question, when we're looking at, opening up the economy or decreasing our restrictions on social distancing, we're looking at case rate. So we want to make sure that we're seeing a drop in our case rate every day. We also are going to look at our healthcare capacity. So a primary goal for this outbreak is to make sure that we don't exceed our healthcare capacity to provide quality care with a medical surge need of COVID-19 patients. And we also want to make sure we maintain the ability to do testing for those who need COVID-19 testing and contact tracing. So the variety in our cases over the past couple days or past week has largely been due to also the variety of our testing. So we see that as our test numbers go down, our case numbers go down. As our testing goes up, so does our case numbers. And that's evidenced by us maintaining this 5% positive rate throughout the outbreak. So what we really are going to start looking for is a decrease in that positive rate. So maintaining our testing capacity, maintaining our ability to test those who have mild symptoms, and then also starting to see a decrease in the positive rate. And that'll be a really good indicator that we're kind of getting towards on the other side of the curve and starting to see a decrease. It is a good sign that we are starting to see kind of a consistent number of cases reported every day. We look at averages to try to flatten out that variability in testing. And so we do see some good signs. However, we are going to continuously watch it for the next week or so before we can have any confidence in the true trends that we're seeing. Your second question, which usually I remember and I forgot this time, what was it about?
Okay, can you hear me?
Yeah.
Sorry, I think I muted myself again. Just the second question was asking about models and
right.
looking at.
Sure.
Okay.
Yeah. So again, lots of models out there. They are all inaccurate. Some are very helpful. It would be great if we peaked in our deaths this week and then started to see a decline in our deaths. That would be fantastic. And we're always seeking to prevent each individual death in public health. I think there are signs that, again, we are starting to flatten the curve, which would be a good sign with mortality as well. However, we are preparing that, in public health at least, preparing our resources in case we continuously see an increase. So I can't predict at this point, but we're hopeful.
Hi, you've referred to the increase in the past few days in the number of new tests being included in our case numbers. And it looks like the number of new tests kind of per day went up a lot about 4 or 5 days ago. And can you tell us, do you have any information as to why the numbers of tests suddenly doubled and tripled and even quadrupled from what we were seeing, a week earlier? And if that increase has shed any light on why the number of new tests was so low for about a week and a half there.
Sure. So just a week ago, we were able to expand our criteria for testing to include anybody with very mild symptoms, even a single symptom. And so we're likely seeing kind of an increase in uptake for testing due to that kind of relaxing of criteria. In public health, we've also been focused on specific populations over the past week that have had outbreaks or are at higher risk of COVID-19 transmission, such as long-term care facilities. We've done point prevalence surveys on a few of those. We've worked with homeless shelters and done a lot of testing there, as well as some hot spots in Summit County. And so these targeted testing approaches all happened this past week, which likely accounts for some of our increase in testing as well.
Hi, I have two questions. One is about testing. What are the benchmarks to determine if testing is widespread? How many tests do we need to do every day to ensure there aren't more outbreaks once the state starts to reopen? And if we don't have enough resources to test that number of people, is lifting restrictions premature? Then the second question has to do with the testutah.com website. Mm-hmm. How has it been in increasing testing and tracking those who have been exposed And since it's been up for a couple weeks now, so how effective is the Test Utah website?
Sure. So the first question, I mean, the key to stopping this pandemic is to make sure that anybody who needs a test for COVID-19 can get one. It is important that people have, a need to be tested. So exposure to a close contact, working in a high-risk setting, or symptoms consistent with COVID-19. We are at a great spot in Utah that we can provide testing to everybody who needs a COVID-19 test, and that's essential. So we're meeting the mark there. We're making sure that all of our jurisdictions have access to testing now. We've set up mobile units that can go to the rural settings that might not have direct access to a hospital or drive-through site and provide testing capacity that way. We're also working with our testing partners to set up more drive-through sites across the state so that access to testing is adequate everywhere. So there's not a specific number that we're looking at in public health specifically. We just want to make sure that that testing access and availability is there. A key to understanding how much disease and how much spread is going out there is actually going to be antibody testing. So antibody testing is done through, a syringe in your vein, and it takes a tube of blood and it looks for antibodies, meaning that you've been exposed to COVID-19. We're working right now with the University of Utah and the Centers for Disease Control and Prevention to start antibody testing pilots here in Utah, hopefully within the next week or two, so that we have a better understanding of the actual spread of disease in Utah. Your second question is about testutah.com. So, they've been up and running for a few weeks, and it's any opportunity for people to have increased access to testing is a good thing because it allows public health to more readily identify positive cases, and public health does all of the contact tracing, case investigation, and active monitoring from all positive tests. So increased access to testing, again, it is a key to stopping this outbreak, and testutah.com is part of that.
Excellent, thank you. Dr. Dunn, this has to do more with those models. One of those prominent models, the one out of the University of Washington, shows that we're due to have, according to their modeling, 6 deaths each day this week, ramping up to 7 deaths peak for several days over the weekend. And it doesn't appear that your numbers are showing that we're entering the peak quite like that. But if indeed we are entering the peak this week, are our hospitals ready for a dramatic surge that may come?
Yeah, I mean, we are very fortunate in Utah that all of our healthcare systems are prepared for a surge in patients due to COVID-19. They all work together to stop elective surgeries, for instance, early on in this outbreak, and it's allowed them to have adequate supplies of PPE as well as beds for those who might need hospitalization or ICU beds due to COVID-19. So we're definitely prepared in the state for that.
Yeah, do we know of the 28 deaths, how many of those people are over or 60 or older? I noticed you said today, again, the person who died over the weekend was older than 60.
Yeah. So I don't have those exact numbers off the top of my head, but I do know that the vast majority of our deaths have occurred in adults over the age of 60 in a hospital setting with underlying medical conditions. So it's following the trend of the rest of the nation in terms of demographics for people who are most at risk for severe disease from COVID-19.
Hi, I just had 2 more questions. There was a death last week at a long-term care facility. I believe it was in Utah County. And there was going to be testing of all of the residents and staff there. And I'm wondering if any more cases have been found at that facility. And if so, if there's any action taken like there was at Pine Creek with the, transitioning of the facility to COVID only. And the other question I had was, do you know whether any of the hospitalizations or deaths involve patients who contracted the virus in a correctional facility?
Sure. So to answer your second question first, No, none of the deaths thus far have happened due to a correctional facility that I'm aware of. The long-term care facility outbreaks that have happened, the most recent one, yes, for every long-term care facility where we've identified a single patient with COVID-19, we have gone in and tested all of the residents and the staff as part of that investigation. And then we immediately cohort, meaning separate, staff and patients. So staff with COVID-19 don't come to work. Patients with COVID-19 or residents with COVID-19 are physically separated. So in some instances, the patients and residents have had to go to a different building. Some they're able to separate appropriately within the facility. And then they have dedicated staff that care for them, so that staff that care for the COVID positive patients or residents are not caring for the non-COVID. And then we're going to do follow-up testing. So for those residents and staff who tested negative, we will follow up within the 2 weeks to test them again, because the incubation period is 14 days. So those are routine procedures that we do for any long-term care facility outbreak, and we're doing it in these instances as well.
Hi, Dr. Dunn. A couple of questions. Wouldn't an ideal testing environment include randomized testing in the population? And then with regards to the Hispanic population having higher rates of COVID-19, you talked about how that population in particular, doesn't have the option to work from home. And you can see that, if you're driving around like the trades, like construction, they're working. And I guess my concern is, don't you think we'll see that same uptick in the rest of the population when basically the restrictions are lifted or relaxed and you get more people interacting with each other at work, et cetera?
Sure. So with regards to your last question, the Utah Leads 2.0 is set to roll out slowly. So we're not going from the restrictions we have currently to everything being open the way it was pre-COVID. So the gradual relaxation of restrictions will allow us to assess the impact of each relaxation and see how that impacts our number of cases. And then if we need to, and we see an increase, put those restrictions back in place before we start loosening them even more. And so I think that that's a great way to start in terms of using data to drive the way we're doing social distancing relaxation. And then you'll have to remind me of your first question, Isaac.
Yes. In an ideal testing environment, would you want to include randomized testing of the population?
Sure. So something really important to know about testing. So we've got two different types of tests that we're talking about. One is PCR, and that's the nasal swab that people are using to be diagnosed with active infection. And then there's the antibody testing, which is a blood test that determines if you've been infected in the past. Both of those are dependent. Their accuracy is dependent on how many people have the disease in the state right now. So we have such low prevalence right now of COVID-19 that if we do randomized testing across the state, there's a high risk of false positives. And so that means that you might go get a nasal swab if you don't have any symptoms and haven't been exposed to a confirmed case of COVID-19, and it can come back positive. And we as public health would treat that as a positive. So we would do contact tracing. We would recommend isolation for you and your close contacts. When at this point in the investigation and this point of our outbreak, the false positive rate is high. So we really want to balance the need to know a lot of information with the ability to get really good and solid information that we can make accurate decisions on. So randomized testing does have a place, but it needs to be very thoughtful so that we don't get a lot of false positives. Okay, thank you guys so much. I appreciate it.